if I told you one of the biggest health problems in America is hiding in plain sight? It could be the reason behind stubborn belly fat, fatigue, fatty liver, high triglycerides, prediabetes, and even type 2 diabetes, all the while you're being told your blood work is normal. The real tragedy is that millions of Americans have it and don't even know it. People spend years feeling like something is wrong. They gain weight despite eating better. They struggle with fatigue. Their waistline keeps growing. New health problems keep appearing. Yet they're told everything looks normal. That hidden problem is called insulin resistance. And if no one has ever measured your fasting insulin, there's a very good chance no one has ever looked for it. So why is one of the biggest health problems in America still hiding in plain sight? Why don't more doctors identify it before it progresses to fatty liver, to prediabetes, type 2 diabetes, heart disease, hypertension, now that's a big one, and so many other chronic conditions? Today I'm going to answer those questions because once you understand why insulin resistance is so missed, you'll begin to see your own health and your lab work in an entirely different way. Hi, I'm Dr. Kim, a board-certified naturopathic doctor, and my mission is to help you recognize the symptoms, understand your lab work, and know what to do next so you can change your future before type 2 diabetes does. If you're new to my channel, that's exactly what we do here. We connect the dots, we solve metabolic mysteries, because too many people spend years treating their symptoms, one after another, without anyone stepping back and asking, could all of these symptoms be connected? Now here is the question that has changed my practice. The one question that has changed the way I look at metabolic health. Why is insulin resistance so underdiagnosed? The answer surprised me years ago. It wasn't because insulin resistance is rare. It's actually because it's incredibly common. The problem is that we usually don't look for it. Instead, we wait until it becomes something we recognize. Prediabetes, then type 2 diabetes, then fatty liver, and here comes high blood pressure, high triglycerides, PCOS, metabolic syndrome, heart disease, and then high blood pressure. These are the names people know. Insulin resistance, not so much. The problem is we diagnose the disease, but not the process of getting there. Think about rust on a car. Nobody walks outside one morning and suddenly finds their car completely rusted. Rust develops slowly, day after day, month after month, year after year. And by the time you notice it, it's been happening for a very long time. Insulin resistance is similar. It develops gradually. Most people don't wake up one morning with type 2 diabetes. The metabolic changes often begin years before diabetes is diagnosed. That's why I say diabetes is frequently the destination, and insulin resistance is often part of the journey. Unfortunately, most people don't know they're on that journey. So now, why does your body make insulin in the first place? Let's make this simple. Every time you eat carbohydrates, and to a lesser degree protein, your pancreas releases insulin. And insulin is not the bad guy. In fact, insulin is absolutely essential for life. Its job is to help move nutrients into your cells where they can be used for energy later. Without insulin, you wouldn't survive. So the goal isn't to eliminate insulin. The goal is for your body to respond to insulin normally. So, now what happens during insulin resistance? Imagine someone knocking on your front door. The first knock. You answer immediately. Now imagine somebody knocks every few minutes. Eventually you stop responding. Your cells can become less and less responsive to insulin over time. When that happens, your pancreas often compensates by producing more insulin. It's trying harder to accomplish the same job. And here's what's fascinating. During this stage, your blood sugar may still look perfectly normal. And why is that? Because your pancreas is working overtime. It's making enough insulin to keep blood sugar under control. From the outside, everything appears fine, but beneath the surface, your body is working much harder than it should. That's one reason insulin resistance is so easy to miss. So why don't normal labs always tell the whole story, you wonder? Have you ever heard someone say, "My doctor told me everything looks normal," and then they tell you they're exhausted, they're gaining weight, their waistline keeps growing, they crave sugar, and then you see the skin tags, they're developing fatty liver, or they simply don't feel like themselves anymore. How can both things be true? Because routine screening often focuses on the end result, blood sugar, hemoglobin A1C. And yes, these tests are extremely valuable, but insulin resistance can begin years before glucose becomes abnormal. That's why someone may experience metabolic symptoms while their glucose remains within the normal range. A fasting insulin level may provide additional information in some cases, but it's only one piece of the puzzle. The more useful evaluation comes from looking at symptoms, physical findings, family history, and lab work together. That's how you begin connecting the dots. Think about all your friends. One has high blood pressure, another has fatty liver, someone else struggles with weight, another develops type 2 diabetes, someone else has high triglycerides, and they're all seeing different specialists, taking different medications, receiving different diagnoses. But very few people stop and ask, could these conditions share a common metabolic process? That's the conversation I want more people to have. If today's video is making you wonder whether insulin resistance could be affecting you, I created a free 1-minute insulin resistance risk assessment. It isn't designed to diagnose disease. It's designed to help you recognize warning signs that deserve a closer look. You'll find the link in the description below this video. Take 1 minute, complete the assessment, then come right back because in the next few minutes, I'm going to explain why medicine has historically focused on blood sugar instead of insulin and why that matters for your health today. So, now why is insulin resistance so underdiagnosed? Again, how does insulin resistance develop quietly for years before type 2 diabetes is diagnosed? I want to explain another reason it's so often overlooked. It's because most people don't think of their health problems as being connected. Think about this. One person will develop high blood pressure, another fatty liver. Someone else struggles with weight gain. Someone else has high triglycerides. Another person develops PCOS, or you might have a combination of all these. Another is told they're diabetic. These all sound like completely different conditions, different doctors, different medications, different diagnoses, different specialists. But what if several of those conditions were influenced by the same underlying metabolic problem? That's exactly why insulin resistance is so easy to miss. We're looking at individual branches instead of asking what's happening at the root. Imagine standing under a tree. You notice one branch dying. You trim that branch off. A month later, another branch starts dying. You trim that one too. And then eventually you realize the problem isn't the branches. It's the root. That's how I think about insulin resistance. The symptom isn't always the problem. Sometimes it's your body's way of telling you something deeper is happening. I ask myself, and you should too, why do we focus so much on blood sugar? And here's something I think everyone should understand. For decades, diabetes has been diagnosed using blood sugar, and that makes sense. Blood sugar is standardized. it's easy to measure. It's an essential tool for diagnosing diabetes. So naturally, most people familiar with glucose, almost everyone has heard of blood sugar, but very few people have heard much about insulin. That doesn't mean insulin isn't important. It simply reflects how diabetes has traditionally been diagnosed and monitored. And as a result, many people never think to ask about insulin resistance until they've developed type 2 diabetes or another metabolic condition. Now, have you ever been told your labs look fine? And maybe they did. At least the labs that were measured. But here's the question I want you to ask yourself. Do your symptoms fit your lab work? If someone tells me they're exhausted every afternoon, they're gaining weight despite trying, they're craving sugar, their waistline keeps growing, they have skin tags, their triglycerides are elevated, I know I sound like a broken record, or they develop fatty liver, I'm not going to ignore those clues simply because one or two laboratory values happen to fall within the reference range. Medicine is both an art and a science. Lab work is important. Symptoms are as important. Your medical history is important. Your family history is also important. And when you put all these pieces together, you begin to see the whole picture. That's why I always tell people, don't focus on a single number. Look at the entire story. If you're beginning to connect some of the dots in your own life, this is the perfect time to take my free 1-minute insulin resistance risk assessment. Again, it's not designed to diagnose you. It's designed to help you recognize your warning signs that deserve further evaluation. You'll find the link below, and then come back and finish this video if you decide to stop it and fill out the quiz right now. Now here's the good news. Everything we talked about today might sound discouraging, but I find it actually quite encouraging because insulin resistance usually develops over time, and that means many people have an opportunity to recognize it earlier and then take steps to improve their metabolic health. Now, the sooner you recognize the process, the sooner you can have informed discussion with your healthcare providers about your symptoms, your lab work, and what changes might be appropriate for you. My goal isn't to frighten you. My goal is to help you ask better questions, because better questions often lead to better conversations and then better healthcare decisions. That's why I created this channel. I want you to recognize the process before it becomes a diagnosable disease. And before you leave today, take my free 1-minute insulin resistance risk assessment. If your score raises concerns, email me. I'll help you understand what your score may mean and explain the next possible steps for you. If you'd like to work with me personally, you can also schedule a coaching call using the link in the description. And I want to leave you with one thought. Most people spend their lives reacting to disease. I want to help you recognize the metabolic process that may come years before disease, because the earlier you recognize it, the more opportunity you have to change your future. I'm Dr. Kim, the Insulin Resistance Doctor. If this video helped you understand insulin resistance in a new way, please like the video, subscribe to the channel, and share it with someone who has been told they're fine but knows something isn't right. Until next time, take care of yourself, and I'll see you in the next video.